Hi everyone, it's Dr. Dave and welcome back to Dr. Dave's 411. Last week, I spoke about a very common question I hear on a regular basis. Will cholesterol-lowering medicines called statins damage my liver? This week, I am going to speak about the number one most common medicine-related question I get every single day. Dr. Dave, my muscles are killing me. Is it the statin I am taking? All you need to know about statins and muscle aches on this episode of Dr. Dave's 411. Oh, and did I mention that now you have access to a cardiologist 24/7? That's right, you can reach out to me at drdavedegatti.com for all of your cardiology questions. Just click the Ask Dr. Dave button and type away.
Wow.
Statins such as Lipitor, Crestor, and Zocor are cholesterol-lowering medicines that have been shown to help prevent and treat cardiovascular disease. But we also know they can cause side effects, in particular myalgias or muscle pain. What are some of the characteristics of people who experience muscle aches from statin medications? I thought you'd never ask. Characteristics of people who experience muscle pain from statins include advanced age, typically greater than 80 years old, female gender, small body frame, severe liver disease, and severe kidney disease. The actual risk of developing muscle pain as a result of taking a statin is about 15%. Studies have shown that up to 30% of people stop taking the statins because of muscle aches, even when they were taking a water pill and not the actual medicine. How is this possible? Well, there is something called the nocebo effect, different than placebo effect. A nocebo effect occurs when people who hear about the side effects of taking a medicine, even before they start the medicine, are more likely to have the side effect. For example, if you hear from friends, family, or the media that statins cause severe muscle pain.
We're back now with news about the blockbuster cholesterol drugs called statins. But many patients say the side effects are just too painful.
But they can also cause debilitating side effects. Muscle pain.
Every time I moved, I get this more of a bad achy.
Individuals with statins often feel muscle pain.
Problems including muscle pain.
Then you are more likely to have the same pain after starting a statin, even if the medicine is not having any effect at all. Put another way, a strong predictor of you experiencing muscle pain from a statin is whether or not you've read or heard about the negative effects even before taking the drug. So, you're taking a statin and you have muscle aches. How do we know the pain is actually from the medicine? Most patients who do have muscle aches from statins will have symptoms usually within weeks to months after the initiation of statin therapy, but may occur at any time during treatment. In fact, one study showed an average onset of symptoms at 6.3 months. Approximately 2/3 of patients who had symptoms had them within 6 months of starting therapy. So how do we know if the muscle aches are from taking the statin? A few clues that muscle pain is from statin therapy are as follows. The pain feels like an ache or a cramp, sometimes even causing cramping of the legs at night. Weakness. Sometimes people will describe muscle weakness with or without pain. Symmetrical. The pain typically affects both sides of the body. Large muscles. The pain typically affects large muscles, such as the thighs, shoulders, upper arms, and lower back. If your pain is localized to one area of your body, it is less likely from the statin. So, if you do have muscle-related symptoms, the first thing you want to do is speak with your healthcare provider. Sometimes blood tests will be checked for muscle inflammation. But remember, a person can have muscle pain and still have relatively normal blood tests. Other blood tests that should be considered include thyroid function tests and vitamin D levels, because deficiency in either of these can cause muscle aches in people taking statins. If the pain is persistent, it is recommended to have blood work looking for severe muscle inflammation. Another issue is to review what other medicines you are taking, because some may contribute to the statin muscle pain. So if you are part of the population who experiences muscle aches from statins, then you need to speak with your doctor right away and discuss the next step. But don't worry, because in a future Dr. Dave's 411, I will be speaking about what to do if you have muscle aches from a statin. Okay, who wants to hear Dr. Dave's 411 drill?
No, no, no.
Doctor, you've damaged several muscles, including your calf and quad. Patient, is that true, or are you just pulling my leg? What's the strongest muscle in your nose? Your finger. Okay guys, I will stick to cardiology. Until next time, this is Dr. Dave.